We have compiled a list of FAQs from the parents of children with hearing loss. For this, I would invite Dr. Vikrant to answer these questions for our families on the webinar today.
Thank you.
Let's look at the first question from our parents. As we now understand that the early intervention is very, very important, but it is also very important to know how early can a baby be screened for hearing loss, and that too accurately.
Very important question for an Indian context. Now, gone are the days when you had to wait for a few months or a few years for your child to grow up. Today, in audiology science, that's hearing science, we can actually test a newborn soon after their birth. So within 3 to 4 hours, we would be able to test them. Testing is safe, painless. You have to remember two important tests. Number one is called OAE, and the other one is called BERA or ABR. So if these two tests are done, we can accurately find out whether your child is able to hear or not. I would like to share a message to the attendees of this webinar. In most countries, hearing screening is mandatory by law. The governments have set up initiatives. Now, India is not behind. We are catching up. Some states have already started doing that. But if you come across a newborn child, when you go to meet the family, just have a conversation. Ask if your child has been tested for hearing or not. If they're not, please tell them to go to a nearest audiology or an ENT clinic and get it tested. Testing is time effective, not expensive, and safe. Thank you.
Thanks for telling us that the technology can enable us to screen the babies so early. It is very important for our parents to know that the babies can be screened at the time of birth. Let's look at the next question. As we have discussed that we should not miss the bus and get early intervention, but there are parents who think that the baby has crossed 3 years of age. So is it too late to get a CI now? Or in other words, have they already missed the bus? What would you recommend them?
Yes, a very important question. It's very important that we focus on early intervention. But if your child is already 3 years or slightly older than that, it's still not too late. Don't get disheartened. But because you have lost those 3 years, you need to be having a sense of urgency. You can still get the child implanted. The effort required to get the results will definitely be more. But you will have to put that efforts and bring back your child to listening and speaking world. So time is important. It's not too late. If you already know that your child has hearing loss, irrespective of their age, act now.
Thanks a lot, sir. I think it's a very important message for all the families that it is never too late and the best time is to act now. With this, let's take the next question. This is about the surgery. When it comes to any surgery, we all have some kind of fears, especially those parents who have got the baby diagnosed at a very early age. So now they are in a dilemma, whether they should go for a surgery or they should wait. What is your advice to them?
Yes, this is like catch-22, isn't it? On one side, your baby is being diagnosed with hearing loss. You know the importance of early intervention. But on the other side, your parenting instincts kick in. You want your child to be safe. How could you let my child get operated at young age? So these are very common human reactions. But when we talk about cochlear implants, we are not talking about an ordinary team who's going to implant on your child. We are a team of professionals who are specially trained. It's just not one or two doctors. There's a whole team of doctors looking after your child. Your child's hearing is important to us, but more so important to us is your child's safety. Did you know that in a country like Australia, it's very common to have kids who are 6 months to be implanted on both sides? One kid in USA has been implanted at the age of 3 months. So cochlear implants are designed for young babies. The surgical techniques are precise for young babies. So your baby is in safe hands. Don't worry.
Great to hear that. Great to hear that the surgeries have been done successfully across the globe at such a young age. I think it's important for the parents to understand that the baby is in very, very safe hands of a specialized team. The next question from the parents talks about the usage of hearing aids before the CI. Now, some parents are using it, some parents are not using it. Though we understand there are a lot of factors attached to it. It can be the age of diagnosis, etc. But it leads to a lot of confusion between parents. So, what would you recommend to these families?
Yeah, a very practical question for again in context of our parents. Now we know your child needs to get a cochlear implant. So you would question, why would you spend on a hearing aid? We understand cochlear implants require a lot of financial investment, but it's still important to have hearing aids for three main reasons. Number one is sound exposure. Now, your child has severe to profound hearing loss. That's why he or she is being recommended for a cochlear implant. So that means no matter how loud you shout, your child would not be able to hear. So having a hearing aid till your child gets a cochlear implant gives some sound exposure. It kind of activates or stimulates the hearing nerve. It also keeps the brain networks active. So this kind of sets a foundation for our cochlear implants. So if you had to compare a child with hearing aids and then getting cochlear implants, the results are better rather than just going in straight for a cochlear implant. Second thing is device acceptance. Now, whether it's hearing aids or cochlear implants, these are artificial devices. Your child needs time to get used to them. So if you start off with a hearing aid, your child would be able to accept an artificial device on their ear. And then when you move to a cochlear implant, the transition will be very smooth. The third important thing is emotional bonding between the caregiver and the child. Moment the child is diagnosed to have hearing loss, automatically caregivers reduce the amount of chit chat they have with the children because they wonder, anyway, my child is not going to hear, why should I talk? But if the child had a hearing aid, knowingly or unknowingly, you start engaging your child in a better way. So that helps building on emotional bonds. A small tip is if you are finding it difficult financially to get a hearing aid and a cochlear implant, speak to your clinic and ask for loaner hearing aids. That means you don't have to buy them, kind of rent it out for a few weeks till your child gets cochlear implants. So that's an idea that will also help you. Thank you.
Thanks a lot for, I think, simplifying this so much for us. I'm sure this would have clarified a lot of doubts and confusion regarding the usage of hearing aids amongst the parents. Now, the next question is a subject in itself. But if you can try to address that in a short and simple way for us, that would be great.
Yeah, what are the components of cochlear implant, right? So many components, but to keep things simple, we'll just divide them into two categories. First one is called an internal implant. So that would be something like this. This is the part that gets surgically inserted into your child's skull and ear. Now, this is designed to last for a lifetime. So this is an internal implant. You will probably not see this at all because it will be inside your child's skull. The other important part is the external part, that's the sound processor. Now, this is the one that sits on top of the ear and then an attachment on the skull. There are different shapes and sizes, depends on that. So these are the brains of the system and the implant is the heart. So these are automatic. These pick up the sound, analyze the sound, make it clean and clear for your child and send it to the implant. So two parts, internal implant and the external processor.
Thanks for explaining in such a simple way. I think the parents should have got an overview now. There are two major components of the entire CI system. And also thanks for showing us the models. Now moving to the next question, that bilateral is very, very important. But we also understand that there are challenges with the arrangement of funds. So should parents wait for a year to get a simultaneous bilateral done? Just because they have to arrange for some funds? What is the ideal recommendation in such cases?
Yes. Keep in mind, time is of essence. So whatever can happen at an early time, that is the thing that you have to do. Now we know that your child requires cochlear implants on both sides, but right now, if you're able to, arrange funds only for 1 year, get the process started because it's important for your child to hear. Listening begins, they start to learn language at a younger age. And eventually, you could move on to a second implant. There is a word of caution or a line of caution to all the attendees today, and it's going to get linked to the hearing aid question as well. Now, I have mentioned that start off with a hearing aid and then move to implants. Now, when you put a hearing aid to your child, you will notice your child will start responding to sounds. That doesn't mean that your child does not require cochlear implant. That was just the starting phase, right? Think of it that you're building a building with multiple floors. Getting hearing aid was just the foundation. Likewise, when you get implant on one side, responses become even better. But again, don't relax, thinking that, okay, my child is responding better now, I will stop here and not get the other side. Your building work is not complete, right? It's a process. We start off with the hearing aid, go to 1 year, and then eventually you'll have to go to the second year as well. Because you're preparing the child for school, college, and future life. And for that, we need 2 years. So 2 is better than 1, but 1 is better than none. So acting early is most important.
Wow, I think so easy to remember. 2 is better than 1, but 1 is better than none. Rhyming words and easy to remember. Parents want the best in every single thing for their child. So we have highlighted few of them here, like the best professionals or the best company. There might be a long list of such questions in their mind. What would you advise to such parents?
Yes, a very important question. Now, technology, especially Google search, has made it so much easier for parents to research on their own. But keep in mind, it's your child's future that you're talking about. It's not a research project. We as professionals have spent decades of our life studying this field and understanding the best there is. You're free to research, but set a timeline. Don't keep researching on and on and on, and then on one side your child keeps growing old. It's not going to be of any use. If you want to cut down your research time duration, speak to a trusted professional. If you want a second opinion, speak to parents who already have gone through this journey, who have their children implanted with cochlear implants. So do your research well, but it should be done fast.
Thank you, Dr. Vikrant, for answering all these relevant questions for our families today in a very simple and amazing manner. I'm sure the parents will not make it a research project now, and they will act now.